And as always, the recording will be available in the training portal here later on today. Again, welcome everybody to Advantage Medical Testing Retail Panel Training Series. Today we're going to be discussing the gastrointestinal panel, or shortcut abbreviation GI panel. This is a pretty important panel, but it's very specific. Okay, so many of our panels deal with so many different issues, and even though this panel may appear to deal with a lot of issues, and that is true, it focuses on basically the gastrointestinal tract. And so this is going to be unlike some of our other tests where somebody may go to their doctor, they may know they have gut problems, and so they'll go and try to get a diagnosis from the doctor. And as you'll see in the retail panel reporting here at the end, you'll see that there's a lot of symptoms that are common to a lot of different conditions pertaining to our gut and our intestines. And our gut, we also call that the microbiome. They also call it the second brain. It's responsible for quite a bit of health in our bodies. Now, these are the people who will need this test. Okay, people that have a complaint of stomach or intestinal problems. It's pretty vague, but they know they got a problem with their gut. People with food allergies, especially gluten, casein, which is actually nut whey, and lactose intolerance. People with IBS, irritable bowel syndrome, people with chronic constipation, chronic diarrhea, intermittent intestinal pain, chronic reflux, chronic heartburn, right? And mast cell disorder. Now, mast cell disorder it's a pretty cool thing not to have. It can wreak havoc on your body. And some of the symptoms or some of the problems that can be caused by mutations in these areas are going to be obesity, diabetes, skin conditions, again, IBS, and even depression. So the GI panel studies 12 SNPs. And for those of you first-time callers, the SNPs are the mutations in our DNA that are compared to a huge database of samples collected over the years, the Human Genome Project, and specifically for this test, the 1000 Genome Project. And the way this works is they find people with conditions, they do research, they do this genetic testing, and they compare the results to people that are also experiencing the same problems, either stated or actual proven. And so they have come up with a pretty good database, and they can make certain predictions based upon the mutations in our DNA. And again, remember, our DNA, we're born with it, but it's not static. It's 100% dynamic, and your DNA changes. And it can change in several ways. It can change with what we introduce into our bodies in the form of nutrients or drugs, alcohol, toxins, or what we're exposed to environmentally can actually change our DNA. And so that's why it's important to understand that these SNPs that they study, there's several SNPs that are common in people with certain problems, and they have been able to catalog that. And that's how these tests actually work. So the GI panel studies 3 separate areas. It's going to look at inflammation. Environmental is the name of the title on the caption for the report, but it's going to look at inflammation issues. It's going to look at lactose intolerance, and here's my favorite word, autophagy. Now, we'll get into autophagy again as a recap, but for now, these are the 3 areas that it's going to focus on. Let's go over the inflammation SNPs here. It's going to look at, like I said, 12 total, but there's some variations they also look at. So we're going to talk about the AOC1 SNP. Now, the AOC1 and the one below it, the HNMT, are both mutations that they look at regarding histamine. Now, histamine, if you don't know, is something that's present, within all kinds of foods that we're currently eating, like tomatoes and spinach. And for those of you that drink that weird thing in a jar, I think it's kombucha or whatever, kombucha, that actually contains some histamines. The histamines, I know there's over-the-counter antihistamine drugs, right, allergy-type medicine, but histamines are needed in our bodies. Histamines are needed to help fight, disease and infection. And one of the things that a histamine will do is it'll dilate the blood vessels when there's a problem, and that'll allow the white blood cells to go do their work to fight the disease. So histamine's important, but if we have too much histamine in our body, it just wreaks havoc. Okay, and so something interesting here is we actually have, regardless of how you believe we were put on this planet, we have a backup system for a lot of things. And this is one of those systems where we have a backup for, is our immune system. And histamine actually, it's so important to help fight infection and disease that, again, our complex machine body that we have a backup. So that's why there's two of them there, AOC1 and HMT. Now we're going to talk about the FUT2 SNP. This SNP here is dealing with probiotics and prebiotics. And if you recall from one of our previous sessions, probiotics are very important to help with gut health. And so what's even, as important, I guess, would be prebiotics. Now, prebiotics are actually the food for the probiotics. So we see all these commercials on TV, like with the yogurts, and everyone's on this probiotic kick and stuff. And there's some, supplements that we can take, of course, for probiotics and prebiotics. This is, again, just as important, because if the probiotics don't have anything to eat, then they can't stay alive to do their job. Of course, some of the problems are, worst case scenario, Crohn's disease, and almost as serious as a leaky gut. And so one of the things with the probiotics that's very important to understand is that if you're drinking a filtered water and that water's been treated with chlorine, you can take a probiotic pill, and as soon as you take a sip of that chlorinated water, you're killing the pill, you're killing the probiotics. So it's kind of silly to think that you're going to put these pills in your body and then you're going to chase it with something that's going to kill what you're putting in your body. Some of you may or may not have known that. Next SNP we're going to look at here is the NOS2. And if you remember high school chemistry, NOS is dealing with nitrous oxide. And nitrous oxide is produced to help kill some of the bacteria in our gut. So whenever we get an inflammation reaction in our body, then the NOS2 kicks in, and that's going to make nitrous oxide, or convert things into nitrous oxide to help kill the bacteria in our gut. Okay. Looks like we have no video. Okay. So you know what, guys? I hate to do this to you, but I'm going to go ahead and start this over, okay? All right, Christian, Advantage Medical Testing, welcome everybody. We're going to continue our retail panel series. Today we're going to start out with the gastrointestinal panel, or GI panel. And this is a redo, so some of this will be repetition, and I apologize. All right, so let's talk about the GI panel. Who needs a panel? People with stomach and intestinal problems are going to need this panel. This is a specific panel, and like all of our other panels that have a lot of different areas to look at for one simple test that can be conducted with that cheek swab, this is no different. However, the focus is on our GI tract, which consists of our stomach and our intestines. All right, so the people that would need this test, being that you have a lot of different stomach and intestinal issues, there's a lot of symptoms that are common to all of these issues. And so it's therefore very difficult to sometimes track down the actual cause of the person's complaint. Now, the alternative to this test is like a microbiome test, which is very, very expensive. $400 and higher is not uncommon to get this test. And what that test will do for you is help you isolate the problems in your gut, in your intestinal tract. This is a great alternative because the DNA tells the real story. And if we remember, DNA is not static. It's dynamic. We're born with certain DNA traits, but the things that we introduce into our bodies, such as the foods we eat, the chemicals that we ingest, and the things that we're exposed to every day in our environment, those toxins. But the people that will use this panel or need this panel will know that there's something wrong with them. They'll know that whenever they eat things or do certain activities, they have problems in their gut or in their intestinal tract. So people that have known food allergies, yeah, they need this test as well. Gluten allergies, which we'll talk about in depth in a few minutes. Casein, which is a nut whey. And lactose. There's a lot of lactose intolerant people out there. Misconception about lactose is that it's a milk allergy, and that's not a true fact. We'll talk about what lactose is also. People with IBS, irritable bowel syndrome, people with chronic constipation or chronic diarrhea, intermittent intestinal pain, chronic reflux, which, as you know, it is heartburn, but chronic, though, they always have heartburn, and mast cell disorder. Mast cell disorder, again, it's a pretty serious condition, and some of the things that can lead to, if they're not treated correctly, if you have problems with the mast cells, is obesity, diabetes, skin conditions, IBS, and believe it or not, depression. So the GI panel studies 12 SNPs, and there's 3 different areas that it focuses on. It focuses on inflammation, and it focuses on lactose intolerance, and it focuses on autophagy. Autophagy should not be a new term for most of you on the call, but for our guests today, we'll get into what autophagy is as well. So these 3 areas, only 12 SNPs. Wow, I mean, that doesn't seem like a lot, but these 12 SNPs that they're going to look at, and again, a SNP is the mutation of your genes. These 3 SNPs, or these 3 areas rather, these 12 SNPs will give us a really good look at what's actually happened inside of our microbiome, which is also known as our second brain, and is responsible for so many things regarding our health. All right, so let's get into the inflammation area of the panel. The AOC1 and the HNMT. These are 2 SNPs they look at regarding the same thing, histamines. Histamines are present in the stuff that we eat. You know, a lot of the green vegetables, or actually, like, not a lot, but some, like spinach. There's others, tomatoes, and I talked about this in the previous recording, those that drink that kombucha stuff with that thing that floats around in there. So these things can contain histamines. Now, if you recall, anyone with allergies on the call, if you go look at some over-the-counter or even prescription allergy medicines, a lot of them will be an antihistamine. Now, that doesn't mean that histamines are bad in our body, but an excessive amount are. And so when you take an antihistamine, you're actually suppressing the production of histamines, which is actually affecting your immune system. And so histamines are needed to help fight disease and infection. Histamine does a few different things when it's released, but one of the things that it does is to dilate our blood vessels, which allows the white blood cells to get to the problem areas in our body a lot faster. Now, our body is a very complex machine. We all know that. But we have some backups, okay, in here for certain systems, and this particular histamine issue, we have a backup. That's why you see the AOC1 and the HNMT, because it's a backup. In case the first one there's problems, then the second one can kick in, because to be quite honest, if you can't produce histamines, you'll die. If histamines are not in your body, they will not allow the white blood cells, quickly enough sometimes to get there, so someone could die. The FUT2 deals with probiotics and prebiotics. We know what probiotics are. We know it's important for our gut health, but some of us don't know how important the prebiotics are. Prebiotics are what probiotics eat to be able to survive in our gut. Some problems with probiotics production or prebiotic production can give you leaky gut, or more seriously, a Crohn's disease. Now, I talked about this before, but with our water being treated with chlorine in some areas, as soon as you put a probiotic pill in your mouth and you follow it with chlorinated water, you're killing the probiotics in your gut. Okay, so when you're drinking chlorinated treated water, you are doing damage, to your second brain, the microbiome, by killing those probiotics. So that's something to look at. If someone's got problems with their gut, but they're taking probiotics, eating that Jamie Liqueurs yogurt, and all of a sudden, they're still not seeing the effects of taking that probiotic, it's time to take a second look. What are you drinking? What else are you putting in your gut? Then we're going to talk about the NOS2 here a little bit. The NOS2 from high school chemistry is nitrogen oxide, right? NO. And so that's important, because nitrogen oxide is what is produced to kill the bacteria in the gut, the bad bacteria. And so when we get some inflammation, NOS2 kicks in, nitrous oxide gets going, starts killing those bacteria in our gut. But here's something interesting. It's very important, okay, and to have the nitrogen oxide in our bodies. However, one of the side effects or consequences of that nitrogen oxide getting produced is a free radical. And if you recall from our last panel, free radicals can cause havoc in our bodies as well. And the free radicals, of course, just a refresher, is when that oxygen molecule loses a couple of electrons, they start flowing around your body looking for more electrons to bind to more cells, and that causes problems, causes mutations. And aging, so free radicals are responsible for our aging process. Let's talk about the HLA-DQ-A1 and 2. I've bolded the QA2 simply because the HLA-DQ1 mutations are very rare in people. All right, the HLA-DQ-A2 are very common in people. Approximately 25% of the people, 24 to 25% of the people, have this mutation, and this is the gluten one. Okay, gluten, of course, is present in wheat, barley, and rye, causes celiac disease. It's interesting, though, that almost 25% of the population has this mutation. However, it does not mean that you will automatically have celiac disease or a gluten allergy. However, when we have that present as a possibility with one set of dominant genes and even one set of recessive along with it, you should still watch what you eat. And be prepared, like when you're going to go eat a lot of gluten, to take a supplement, before, because that can prevent a lot of problems. So celiac disease is actually an autoimmune disease, and celiac disease is probably the most serious problem that will show up when we have these mutations. And what celiac actually does is, we all heard of what gluten is, right? Well, when you ingest gluten, when you have celiac disease, your body starts to attack your intestines. Once gluten's introduced in the body, it starts to eat your intestines and attack them. So here's some interesting facts, some interesting things with gluten. Even if you don't have celiac disease, here's some scary stuff. As simple as bloating when you eat gluten. Maybe you have some diarrhea, constipation. And this one's kind of silly, right? Smelly feces. But of course, it doesn't smell like roses anyway, but you'll definitely know. You'll be informed by the people that live in your house. Abdominal pain, headaches, sometimes migraines, fatigue, skin problems, depression, anxiety, and unexplained weight loss. I pray for that every day. Iron deficiency, anemia, joint and muscle pain, leg and arm numbness. So believe it or not, somebody could eat a big meal at a restaurant with a lot of gluten in it, and they can start feeling their left arm going numb. That may make them think that they're having a heart attack. And brain fog, of course, not thinking clearly. All right, so let's go into the lactose intolerant SNP. There's only one that they look at, the MCM6. And lactose is not milk, right? It's present in milk, but what it actually is a sugar. Now, this mutation is mostly common in African Americans, but it's not strictly isolated to African Americans, but it is most common in African Americans. And when you have problems, look at these problems you can have with this mutation. Stomach pain and bloating, look familiar. Diarrhea, should look familiar. Increased gas, constipation, we saw that before. Headaches, fatigue, brain fog, muscle and joint pain, skin conditions, specifically like eczema, mouth ulcers, hard to say, and problems urinating. So hopefully you've noticed that there's a lot of similar problems here when this mutation pops up. It's similar to gluten stuff, right? So now you can see that if you complain of any of these things, how important it is to get it isolated. Because you may think that you're lactose intolerant, so you're drinking Lactaid or whatever it's called, the lactose-free milk, and you're not having any problems, with those pills you're taking. But hey, you put a little, gluten in your diet, and all of a sudden you're having problems that you thought you were lactose intolerant because you were maybe told that you're lactose intolerant when you were a kid. The funny thing is that this lactose intolerance can show up at any time in your life. So you could be drinking the heck out of milk when you're a kid. You get to be an adult, and you have a yogurt, and you're like, what? So you can have all kinds of problems as you get older, and it can show, like I said, it can show up anytime. Last but not least, my favorite is the autophagy part of the panel. Autophagy it's been being talked about for a long time, but it was really laid down, the track was laid down here back in 2016 when the autophagy test actually, won a Nobel Prize in medicine because of what it led everyone to learn. So what is autophagy? Well, we can read it. It's natural, intercellular, blah, blah, blah. But basically what it is it's how your body gets rid of the bad stuff at the cellular level, the detox. Okay? And so it looks at these genes that we've seen several times in our panels now because they're so important, these mutations, ATG5, ATG16L1. And so when you have problems with these and with your autophagy, you can have type 2 diabetes, you can have insulin resistance, PCOS, fatty liver disease, neurological disease, autoimmune diseases, and even hearing loss. And so then the NOD2 in card 15, that's going to be dealing with how our body clears bacteria out of our intestinal tract. IBS. So let's look at some more issues with autophagy, okay? Autoimmune diseases like lupus, rheumatoid arthritis, Sjögren's, hearing loss, detox problems, IBS shows up quite a bit, right? Neurological diseases, but a lot of repeats here. Look at the developmental ones, man. Alzheimer's, Parkinson's, development, and dementia, autism, and here's the scary one, cancer. So if you've got problems with your autophagy in your body, then it could be very, very serious. All right. So those are the three categories that they look at in this panel, 12 SNPs. Price on the test is only $249 versus, $400 or $500 or $600 for that microbiome test. Now, if this test comes back with issues, remember, we're going to go through the panel here. It's laid out like this. Remember, we've got our green, kind of tannish, and red. Now, this is repeat, but for new callers today, heterozygous result and homozygous result, what these two terms are is, and I use this example, you're born with a gene that's dominant from your parents for freckles. Okay, you have mom says you're going to have freckles with her dominant genetic coding, and dad says you're not, a recessive gene. So that's heterozygous when we have one dominant and one recessive characteristic of the gene. When both parents have a dominant trait, that's called homozygous. So we have a chance of getting freckles if we get the gene from one parent. But if we get both dominant genes for freckles, guess what? We're going to be that kid. Okay? So this test looks at the heterozygous and homozygous results and puts them in a color coding, green being nothing to really worry about. Tan, brown, amber, whatever it is there, is something to consider, and homozygous is definitely something to deal with. Okay, so these tests give us 3 different areas of reporting. The first area of the test is the therapeutics, okay, that's recommended, and that's something that you and your doctor can discuss about what pharmaceuticals to use or what natural supplements to use. And then we have a highly recommended area, which kind of coincides with that, but then in progressive provider discretion. But the second major area is lifestyle recommendations. So we have a first one, therapeutic recommendations, drugs and supplements, and then we have lifestyle recommendations, which is stuff that you can do without your doctor. And then we have some further testing that is recommended. And so some of the things that will commonly pop up on here for laboratory recommendations is if there's any recommendation that regards more than one pharmaceutical or recommends a pharmaceutical and knowing that you're already taking other ones, you'll see that it will recommend PGX testing. Okay? So here we go. Let's go through this report real quick. We're not going to spend a lot of time on it because, again, the goal here is not to be able to interpret these reports. It's just to show you how in-depth they actually go and to show you how important it is that these results get provided to the person's doctor and discussed with that doctor. So here we go. So it looks like we've got a heterozygous result in AOC1, okay, and but we have our backup plan, the H&MT, are greens. Okay, so this right here says there is a possibility, even though our backup is running, that they may have a problem with histamine. Okay, and so you can see there's no pharmaceuticals or like highly recommended things here for the doctor to look at, but there are some provider discretion stuff, and these are name brands, to give to their patient. But this doctor, when he sees this report, is not going to be too concerned unless there's other things going on, because they can see that their backup system is running great, and there is just a likelihood that they could have issues with histamine. Okay, so this might be something where, process of elimination, everything else, they're complaining of this, these other issues. They can't really track it down, even with this. So then they say, well, you know what? It's not going to hurt you to, get some support for your histamine system. Now up here, FUT2, that's our probiotic, SNP. And look at that. It's heterozygous, which means mom and dad have passed this on as a dominant characteristic to this person. And so definitely there's problems here with this one. So they're going to go ahead and give them some probiotics. Makes sense. Pretty simple, right? Problem with the probiotic production, give them some probiotics. Okay. And then, though, over here, if it doesn't get better, they are, in fact, recommending that microbiome testing if it doesn't get any better. So they'll monitor this person for a few months and see how it's going, if they can stand it. Then we've got green here and the HLA-DQA1, because that's a very uncommon problem, but the HLA-DQA2, again, 24 to 25% of the population have this mutation. And so even if they don't have celiac disease here, they're going to tell them to basically lay off the gluten. Okay, and they're going to say, hey, if you're going to go have a pizza party, take something to help you process that gluten. So that's just a recommendation. Now, if we go down here to the MCM6, again, most common in African Americans, however, this one here, again, another homozygous result. So this person, without a doubt, is going to have problems with lactose. It's pretty much a guarantee. And look at the recommendation. Avoid lactose. Kind of makes sense, right? Our autophagy genes are looking okay, but there are some likelihoods that we may have some issues with autophagy here. Okay? And so with all of these heterozygous results here, and only one being nothing to worry about, they're definitely going to do some things here with this person because of these results. Even though there's only one dominant gene, look at them. All these other SNPs, they have a bunch of the one dominant gene things going on, so they're going to probably have some problems. All right. Again, you get a summary, okay? Those three areas we were talking about. For the person that just wants to flip to the back, it gives them those recommendations. Lets them know what was actually looked at and the variants and some definitions. Okay, so this is going to assist the doctor. Now, if they go to the doctor and the doctor looks at them like they're handling them, Latin, they have resources at their disposal. It's the doctor's job to seek, proper treatment for that patient. So trust me, when they go to their doctor, if they don't feel they're equipped to handle all this information, they're going to make a phone call, okay? And they're going to get some either referral or they're going to have somebody else come in and help out if they can't handle it, okay? Well, that right there, in a nutshell, is our GI panel. And again, it retails for $249. Very inexpensive. Saves them a lot of money. All right, so I'm going to end the recording and open up the lines for questions.